next up, we will have Dr. Abigail Bretzin. Thank you so much. And as you make your way toward the podium, I'll begin to read your bio. Dr. Abigail Bretzin is a research investigator and member in the Department of Emergency Medicine and member of the Michigan Injury Preventive Center before joining the Michigan Injury Prevention Center. Dr. Bretzin completed her postdoctoral research fellowship at the University of Pennsylvania, gaining immense training in epidemiology. During her postdoctoral studies, she also completed NIH-funded training programs in sleep and traumatic brain surgery. Dr. Bretzin earned her PhD in kinesiology at Michigan State University, Delaware. Thank you. One more round of applause for her again.
Awesome. So first of all, I want to say thank you all for coming here today. There's not many opportunities where we can get members of the community together on a Saturday to talk about the brain, and so I'm super excited and thankful for you all to be here, and also very thankful for Priscilla for bringing this network of people together. We wouldn't all be here today without her, so again, a big thank you to Priscilla. And before I get started, I'll talk a little bit about who I am and my background and why I'm here today, and also introduce you to Dr. Doug Wiebe. I was a soccer athlete in high school. I'm from around Buffalo, New York, and I always wanted to be involved and engaged in sport throughout my life, but I wasn't good enough to do so participating as an athlete. And so I was looking for opportunities how I can stay involved in sport, and I learned about athletic training, which is an allied health profession to provide medical care for athletes when they're participating in sport. And so I went on to do my undergraduate degree at SUNY Cortland in Central New York to become an athletic trainer. And it was there where I really got interested in sport-related injury, specifically sport-related concussion. And from that, I learned I wanted to learn more about concussion research, and work as an athletic trainer. So I went on to do my master's degree at Temple University in Philadelphia, where I studied sex differences in concussion potential mechanisms, and also worked as a high school athletic trainer in the Philadelphia City School District. And from there, I learned I really liked concussion research, and so went on to do my PhD, my doctoral studies at Michigan State University, so go green. And from there, I learned there was a huge gap in our understanding of how many people are really affected by this injury, and I wanted to learn more methodologies of how to improve the science in that field. So I sought out a postdoctoral position at University of Pennsylvania with Dr. Doug Wiebe, who directed the Penn Injury Science Center there. And in meeting him and growing, there was an opportunity for him to move to Michigan to direct the Injury Prevention Center at the University of Michigan. So I also want to bring up Doug Wiebe to the stage.
Thanks so much, Abby and Priscilla, and Healthy Two Connections, and everyone. It's just a real honor to be here. It's a delight. I'm with Abby, as you see, and with Taylor Hautala. The Injury Prevention Center at U of M is one of 11 that's funded by the Centers for Disease Control and Prevention. Dr. Perry, very lucky to still be funded in this time when things are sketchy. And so we're the folks with the booth over there, and again, delighted to be here. We are learning so much. If there are ways immediately or in the long term we can help to amplify the amazing work and ideas that are happening here, we would love that. And also love opportunities to partner together. Our injury center works on all things injury: fall, burn, motor vehicle crash, overdose, brain injury, traumatic brain injury, from A to Z. But indeed, brain health is a priority for us. One of the studies that we have that Abby and I have been working on since we were at Penn is called the Ivy League Big Ten Epidemiology of Concussion Study. It's a surveillance study. We're monitoring athletes across those two conferences, learning when concussions happen, trying to figure out why they happened, ideally prevent them from happening, get them to definitive care quickly, and after care, improve long-term outcomes. So that's primary, secondary, and tertiary public health. And just briefly, would you be able to hit the next slide? As a priority area with this group is the topic of chronic traumatic encephalopathy. Dr. Turner referred to that in the constellation of things like dementia and Alzheimer's disease. And so much good work has been done, so much good science on dementia, Alzheimer's disease. Very little about chronic traumatic encephalopathy, even though it's becoming a household name. In epidemiology, I'm a professor of epidemiology. It's all about studying in a given population, what are the ailments that are most common, and why did they come to be? What caused them? If we can figure out what causes them, we can figure out how to prevent them. So epidemiology is all about figuring out what bad things are happening, but how do we prevent them? And as much as we're learning about CTE, we don't know the constellation of things that might come together to cause it. So we're just getting started with one robust epidemiologic study to better understand risk factors for CTE, and then of all the many things that might be involved, figure out what are the levers that are most pullable, what are the prevention opportunities that are most possible for us to get ahead of that. So it's one of the many areas that we're working on, and I see lots of chances to learn from this group and amplify that kind of work together. All right, well, back to Abby again. Thanks for having us.
Yes, so the goal for the slides we put together today are to provide a high impact and concise presentation about what's going on, to introduce key aspects of traumatic brain injury epidemiology, some opportunities for prevention, how health disparities interact with concussion epidemiology, and then also discuss the long-term outcomes. And then we can also allow time for discussion, or we'll stick around to talk. We love to talk about this work overall. So next slide. And so what I first did is I went to my favorite database for where published research exists, which is called PubMed. This is sponsored by the National Institutes of Health, and this is where we can find peer-reviewed literature on concussion and any health ailment that you may want to search about. And so I put in some key terms: traumatic brain injury, epidemiology, prevention, health disparities, and long-term outcomes with some key terms just to see what currently exists in literature and when it started. So if you push the next slide, what you can see is there's a lot of more recent research growing in this area. In the early 1950s is when we really got started in understanding and studying brain injury overall, but it hasn't been until recent years that research has increased. So we push the next slide, and you can see that we have over 22,000 research publications using these key terms when we look for research here. In the next slide, you have, in 2024 alone, we have over 1,000 research articles. So there's no way today that we're going to be able to talk about everything in this space. And the next slide, in just 2025 alone, there's over 500 articles. So that's our job to help find out what's going on in the literature and bring that to you all so we can help learn about it and then do next steps. And so why does this matter? You can just keep looking through it. So concussions affect a lot of people, and they affect athletes at all levels. In short and long term, and incidences that occur after a concussion does happen. And so why are we all today? Because brain health, concussion, injury, mental health, and health disparities all intersect, especially related to this topic. Also, we're aligning in our work with the Healthy to Connections mission to enhance public understanding of neuroscience and its relevance into healthy life. We can go to the next slide. And so, like Doug mentioned, what we study is the epidemiology of concussion, which is the study of the distribution, determinants, and patterns of a given condition in a group of people. And so epidemiology is the cornerstone of public health. It helps us to make policy decisions. It helps us to work in evidence-based practices and bring evidence to treat those conditions that are happening, all so that we can work in preventative health care. I don't have a lot of transitions and slides, so you can just keep clicking. And so I first wanted to talk about who is affected. And in terms of preparing data for this slide, one good resource that exists is the Michigan High School Athletic Association. And what happened is in the early decade of the 2010s, they understood that concussions were a big problem. And so in 2015, they started this database so that all concussions that occurred in high school sports at all 750 member schools were recorded in one place. And so we partnered with them on many different research projects. And a recent one is we looked at, you can go back to it's right there. And in a recent one, what we were trying to understand is how many people are sustaining a sport-related concussion at the high school level, and what types of athletes are these concussions happening to. And so in this graph, there's a lot to look at, but what this is displaying is that over an 8-year period, there's over 25,000 concussions that occurred as a result of high school sport participation. What really sticks out to me here is in this the first bar is football. So as you can imagine, football is a lead contributor to sport-related concussion, with over 10,000 athletes sustaining concussion over this 8-year period. But what sticks out to me, and that's really meaningful, is that concussions are happening across all sports. And so you can see girls' sports presented in green, or the lower bar in each sport, and boys' sports presented in blue. And what tends to happen in those sports that both boys and girls participate in is girls tend to have higher rates of concussion overall. So, for example, in soccer, girls are 1.8 times greater odds of sustaining a concussion than boys in soccer. And so this has motivated a lot of my work, and this study specifically points out that a lot of our youth are sustaining this injury, and if this injury is a risk factor for later health outcomes, we need to think about how we can prevent it and look at targeted treatment options. So on the next slide, we also have a study looking at concussions at the collegiate level. And so what I just showed were concussions at the high school level, specifically in Michigan, but we have a study called the Ivy League Big Ten Epidemiology of Concussion Study. And what we do here is very similar to the Michigan High School Athletic Association. We collect all concussions that happen across all varsity sports in all schools in the 2 conferences. And so what you can see here is I similarly displayed concussion numbers in these sports across our full study period. So this study started in 2013, and we record concussions over time. We collect both sport-related mechanisms, and we collect concussions that happen to athletes in non-sport mechanisms. So our athletes are getting concussions from motor vehicle crashes on campus, scooter rides, bike accidents, they're involved in fights, they're involved in things where they fall on their bed and hit their head. So athletes are sustaining concussions from many different mechanisms, but the most are happening from sport-related mechanisms. And so the reason why I pointed out here is we have a lot of data for you all to ask us questions to. So you can see each year we have over 300 concussions reported us that we can learn from. And I just wanted to break this down by sport. So in the collegiate level, what we also see is football is a big contributor to our concussions. But similar to the high school level, we are seeing concussions occur across all sport types. And in those sports that both boys and girls play, we are seeing higher rates in girls. So just motivation to look for prevention opportunities amongst girls too. And so, like Doug described, in terms of epidemiology, we think of prevention in 3 different ways. First, primary, how can we stop the concussion or the injury or the incidents from happening in the first place? Secondary, how can we think about reducing the impact of that injury or condition that occurred? And tertiary, how can we think about long-term outcomes, improving long-term health outcomes of those that did sustain an injury? And so, in the next slide, for concussion, what does this look like? So, primary concussion, we think about rule changes, we think about policy interventions, we think about improving equipment to reduce the impact that occurs when a head impact happens. For secondary, what we're looking at are sideline assessments. So how can we improve recognition of the injury so that then activate care for those that have sustained the injury? And how can we also increase removal from play? So removal from play is a really big thing that we want to do with concussion to reduce the impact of secondary injury after the head impact does occur. In terms of tertiary, this is really mixed. We can think about more acute long-term effects, so following them throughout replay, getting them back to school, but we also have to think about mental health considerations that might persist months, years, and decades beyond the injury itself. And this is where a lot of ongoing research is happening. And so I just now want to point you to some results, especially those related to the healthcare disparities that we specifically see in Michigan. So first, we are able to study some health outcomes and disparities in both concussion care and outcomes from the injury. But there are a lot of challenges that we're working on and trying to figure out more reasons why and how to improve our research here. And one is underreporting. Another is access to early health care, and a third are both racial and gender inequalities that our athletes face. And so this is a study that I did in collaboration with Dr. Jessica Wallace. She completed her PhD also at Michigan State, so go green again. But then she followed Nick Saban to Alabama, and so now she's working at the University of Alabama. And what we did in this study is we went out to high schools in Michigan, particularly in the Lansing and Detroit area, and recruited football players. And we asked them, have you ever thought you had a concussion and you didn't report it to someone? And so what we did is we recruited both white and black football athletes, and we found that both groups reported sustaining an injury and not telling someone, but that percentage was higher amongst those black football athletes. In particular, we found that 66% of black and 34% of white athletes that sustained a suspected injury in practices didn't tell someone. In terms of games, we found that 77% of black athletes and 62% of white athletes that sustained a potential injury in a game didn't tell someone. And so this is something, it points to a problem, but it's something where we can fix. How can we encourage athletes, especially black athletes, to tell someone when something happens to them? Because then we can activate care and then eliminate some of these healthcare disparities that they may have in terms of outcomes. If they don't tell someone, they're probably going to stay in the game and continue to play, and that's unsafe for them to do so. In the study, we also asked, why didn't you tell someone? There were no specific differences between black and white football athletes in their responses, but what we did find is that them not thinking it was serious enough, not wanting to lose playing time, not wanting to let their teammates down, and didn't know it was a concussion at the time were the most common reasons why they didn't tell someone. So knowing this now is how we can move towards preventative actions, work on this in education, and help target improved reporting so that we can activate care earlier for these athletes. We also did a similar study in boys and girls. Again, these efforts were led by Dr. Jessica Wallace. And what we did is we asked boys and girls were there differences in reporting and suspected concussions. And what we found is that boys were more likely to not report a suspected concussion than girls. Specifically, again, they reported they thought their coach would get mad. They thought their teammates would think they were weak. They thought their coach would think they're weak. It was the end of the season and they didn't want to miss a game. They did not want to lose playing time or let their team down. They thought their parents would be upset if they told someone, or they didn't have health insurance that would then require them to go seek health care in order to be cleared to get back to play. So these are things that we want to work on in terms of telling someone an injury happened first. Another thing I point to is access to health care. And so in this slide that keeps blinking, what you'll see is there's a large database that's studying high schools across the nation to see if they have access to an athletic trainer at their specific high school. If you go back one slide, sorry, there's a weird thing. And what you can see in the data, speaking to Michigan specifically, is that 52% of high schools in Michigan do not have access to an athletic trainer. But if you look at the data more deeply, access to an athletic trainer also varies based on your zip code, where you live. And so those in more rural communities are less likely to have access at their high school than those in suburban or town communities. And so we need to think about this when we're thinking about prevention, because athletes at a given school just might not have someone there to recognize the injury for them and then help them. And why is this important? So in this slide, from the Michigan High School Athletic Association data, what we were able to do is look at concussion cases and see if they had an athletic trainer involved in their care early on, in their first evaluation. And so we broke this down into athletes that yes had an athletic trainer and no did not have an athletic trainer. And if they had an athletic trainer, they were more likely to be removed from play. And so if you think about the athletes that don't have this athletic trainer at their school, they're just put at a disadvantage because they don't have someone there to help them to say, let's get you out of the game and make sure that we're treating you appropriately before you can go back to play. What we also found in that study is that having access to an athletic trainer was associated with early recovery outcomes. So now we're able to remove them, we're able to help them find the next healthcare provider that we need and have their symptoms be resolved and have them get back into sport earlier and more safely. So you can go back one more slide. And so thinking of all of that we do see there are disparities in reporting behaviors in healthcare access, and we're not truly sure how those really influence recovery and long-term outcomes. And so I'm putting a call out to you all to work with us to help to improve these and help us study this in our community. One thing I also wanted to point out as talking about connections is I got to meet members of this group at the event that Dr. Turner was talking about, the Black Men's Brain Health event. And I wanted to point out some resources that exist in other areas for athletes when they're transitioning out of the sport to maintain their health. So there are things like the Harvard Football Players Health Study. UNC has a center for retired athletes. There's a really cool act out of Tulane University where former athletes can go and receive care and be a part of research. But what's a common theme? We don't really have this in Michigan. So call to Tim, let's get something started and think how we can work on retired athletes and study long-term outcomes. And so how can you all get involved is help us raise awareness, help us find who we can educate, what we need to educate, what are your questions that we can help you answer, be engaged in the research process with us, and let's think about policies, education, how can we improve and advocate for athletes' care. Awesome.
Thank you so much.